I'm Dr. Richard Lyon, and in this video I'm going to take you through the Prometheus Bleed Kit and how to use its component devices which have been designed to help control and stop severe bleeding. The Prometheus Bleed Kit conforms to the newly revised 2019 British Standard for a Critical Injury Pack and includes one Prometheus trauma bandage, one soft tactical tourniquet wide, an instruction leaflet, one hemostatic Kitagors XR Pro, one pair of scissors to cut patient clothing and dressings if necessary, one Russell chest seal, a pair of nitrile gloves for personal protection and infection control. We'll now go through these devices individually. This device is a fast application dressing designed to control moderate bleeding. Tear open the package and remove the dressing. Place the non-adherent pad over the wound and wrap tightly. The built-in hook control strips prevent accidental unraveling. Once fully wrapped, secure the trauma dressing with the hook and loop fastening. This device is designed to be used on patients with severe bleeding of an extremity, resulting in effective management of the bleed until the patient can receive definitive care. First, remove the device from its packaging, take off the elastic bands and unwrap the device. Slide or clip the tourniquet around the limb above the bleeding site and pull tightly. Twist the windlass as many times as possible or until the main flow of bleeding is significantly reduced or stops. Be aware that the patient may find this painful. Slip the end of the windlass into the plastic triangle to lock into place. Make sure to note the time of application and write it into the space provided on the tourniquet. This is a hemostatic dressing for the temporary control of severely bleeding wounds. Open the foil pouch and remove the Kitagors. Identify and cover the source of bleeding with the dressing. Pack the dressing completely into the wound track. Make sure to use enough Kitagors to fill the wound and contact all bleeding surfaces. You can use more than one dressing if required. Once fully packed into the wound, apply and maintain pressure until bleeding is controlled. Once bleeding is controlled, you should wrap and secure a dressing onto the wound to maintain pressure, such as the Prometheus trauma dressing. This device is designed to treat open pneumothorax by allowing excess air from inside the chest cavity to be expelled through the device in one direction to help facilitate lung reinflation and minimize further collapse. Ensure that all loose debris or fluid from around the wound has been removed. Remove the Russell chest seal from its packaging and unfold it. Remove one of the plastic butterfly liners and align the device so that when it is adhered to the skin, the transparent central portion of the valve will be directly over the wound. Once aligned, place the exposed adhesive surface onto the patient. You can now remove the second liner and gently firm down across the dressing's adhesive area to ensure that it is properly attached. Ensure that the valve is not obstructed, as this may reduce its ability to function properly. Always consult the full instructions for use for warnings and precautions before using this device.